Welcome everyone. This is a presentation on how to document a complete history of present illness. So what exactly is a history of present illness? In other words, an HPI. So this is the reason for the patient's visit. So you would start off with saying something like, patient presents to the clinic for, and then you'd give a reason for the visit. So it could be acne, it could be rash, it could be a wart, it could be a new lesion of concern. So here are some tips on how to write a complete HPI. First, you want to describe chronologically how the problem began and how it progressed. You want to make the story logical and informative so that the reader understands all of the elements of what is going on. You can use concepts of the old cart's mnemonic to ensure that you have covered the important aspects. These include onset, location, duration, characteristics, aggravating factors, relieving factors, timing, and severity. The HPI is important because it allows the provider to start ruling a diagnosis in or out. You can use old cards to illustrate the pertinent positives, or what is actually happening with the patient. For example, continuous, moderately itchy red patches in the inframammary area that began at 8 p.m. on April 27th after spending time gardening a few hours earlier. Itching worsens at night and improves slightly with cool compresses and aloe vera lotion. No medicated treatments have been attempted. You could also use old cards to illustrate the pertinent negatives, or what the patient is not experiencing. For example, denies new medications, new products, shortness of breath, difficulty breathing. Also note if the problem has occurred in the past and any other related factors. Has experienced similar symptoms in the past after hiking and spending time outdoors. Has taken Allegra 180 milligrams daily and triamcinolone 0.1% ointment twice daily as needed with significant improvement. It is important to try to be as specific as possible. Here are some additional tips worth mentioning. Old cards is important, however, it is not enough. Try to be as thorough and specific as possible when documenting the HPI. You can end the HPI with something like, patient has no other concerns or complaints, and/or is otherwise healthy. You may also include any other additional details for the provider to be able to remember the patient the next time they come in. For example, attending Indiana University in the fall, or the patient's son is getting married in the summer. The next few slides give HPI examples relevant to dermatology. Here we have a patient that presents for an acne follow-up. Note that it is important to document all of the current and past treatments that have been beneficial for the patient, or state why the patient discontinued the medications. Be as specific as possible, noting the accurate dose and how they are applying the medications. Also note any other additional factors that are relevant to the situation and what is making the acne better or worse, and how often they are experiencing new breakouts. You can also document whether they are happy with their current regimen or if they would like to see more improvement. Here is an example of a patient coming in for a new lesion of concern. It is important to document where the lesion is located on the face or body, how long the lesion has been present, and if it has changed in appearance at all since the patient first noticed it. It's also worth mentioning whether the patient has been experiencing any burning, bleeding, itching, or pain. You could also document whether or not the patient has a history of skin cancer. If a patient comes in for a total body skin exam and they are not concerned about any new lesions, you could say something like, here for evaluation of skin lesions. Has brown spots, but not aware that any are changing in size, color, or shape. and nothing is bleeding or pruritic. For patients coming into the clinic with a rash, it is important to ask about possible exposures. These include, but are not limited to, gardening, new topicals, furniture, clothes, skincare products, etc. These should all be documented under the HPI. It's also important to use old cards when describing a rash. Talk about the onset, the characteristics, things that make the rash better or worse, and any other treatments that have been tried. The last few slides show where in the EMR in NextTech that the HPI should be documented. As always, if you have any questions regarding proper HPI documentation, you can ask your clinical leads, managers, or your provider for their specific preferences. Thank you for joining this presentation on how to document a complete history of present illness.